Black and Asian women are 4 times more likely to die giving birth.
Asian women are nearly twice as likely to die during pregnancy or childbirth. So according to a new report by MPs, they don't think the NHS is doing enough to tackle racial differences in maternity.
That's an alarming statistic, isn't it? I was just reading the Embrace report from 2022. There are a few things to pick up on. People from a deprived area, Black and Asian women, are more likely to die giving birth. I was surprised to read that there is a disparity in deaths across races. That's not right. One of the things that has gone under the radar is the rise in mental health. We're seeing young mothers committing suicide. That's a problem. That means we're getting babies without mothers.
Dr. Talha is a junior doctor and told us the lack of resources and representation in maternity care is a big problem.
Staff have been leaving the NHS in massive numbers for better pay, better work-life balance, and that's something the report constantly highlighted. I think there needs to be more representation in the workforce. Generally, I see more Asian and Black people as doctors than I do as midwives or nurses. So it's important that homegrown members of the diaspora join those services as well.
There's a couple of things to this. Firstly, let's understand the causes. Staff are leaving the NHS. I'm not surprised racism exists. I've suffered it myself in the NHS. When we actually look at the figures, out of 100,000 women, about 11 people died. Now, looking at it, specifically, that doesn't sound as bad as it sounds originally. So rest assured, lots of teams, whether GPs, maternity hubs, are working really hard to give the care that's needed. Now, rest assured, people are working very hard, but what can we do? And what's important in this case? I think identifying your health needs, whether physical, spiritual, religious, mental health, and then being aware of all the different services that you can access whilst you're pregnant. I think we need more community leaders and champions. We need more diverse workforce.
The NHS says it's committed to making maternity care safer for all women and has invested £165 million in the maternity workforce,